Good evening. Chair calls to order Legislative Session Day 20-015. I would ask you to please join us in standing for the pledge, followed by this evening's prayer by Councilman Beulah. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with
liberty and justice for all.
Blessings and abundant, for your many and abundant blessings. Thank you for keeping us safe during these challenging times. Thank you for the courage to fulfill our calling and serve in ways that honor you. I pray for my colleagues, other elected officials, law enforcement officers, EMS personnel, volunteer firefighters, medical personnel, and all those on the front lines working, and all of those veterans serving our country. Continue to bless our county and our country. Thank you for all that you do and have done. These blessings I humbly ask in your name. Amen.
Amen. Council, if I may, for our citizens viewing, I just want to remind everyone that we are still continuing to come to you in a virtual format with a modified agenda due to the COVID-19 pandemic, which leads us into agenda number 4, our presentation of proclamations. Council, it is our pleasure to welcome Mr. Lyle Sheldon, CEO of Upper Chesapeake Health Systems, along with Ms. Joyce Fox, Senior Vice President of Patient Services and Chief Nursing Officer, Christine Decker, representing Harford Memorial Hospital, Mary Kate Wigan, representing Upper Chesapeake, here to help us celebrate and honor National Nurses Week, May 6th, 2020 through May 12th, 2020. Mr. Sheldon.
Good evening, Councilman President and other members of the County Council. And I certainly want to thank you for having us this evening. And on behalf of my colleagues at University of Maryland, Upper Chesapeake Health, I'd like to ask Joyce Fox, who's our Chief Nurse Executive at University of Maryland, Upper Chesapeake Health. And Joyce has actually been a nurse for over 40 years and has been one of my esteemed colleagues and one of our senior executives for over 20 years at Upper Chesapeake and leads our nursing division. So I'd like to ask Joyce to recognize the two individuals, two of her colleagues that are with us this evening. And I'll turn this over to Joyce Fox, Council President.
Thank you, sir.
Thank you so much, Mr. Sheldon, and it's my pleasure to be here this evening and quite an honor. I would like to introduce first Christine Decker. Christine Decker is a nurse in our emergency department at Harford Memorial Hospital. Christine has worked with us for over 21 years. She also serves as our liaison for the EMS system, both for Harford County and Cecil County. And then there's Mary Kate Wigan. She is one of our critical care nurses here at Upper Chesapeake. She has worked with us for over 5 years. And she also serves as the co-chair of our Nursing Shared Governance Council and also the chair of our Nursing Quality, Safety, and Patient Experience Council. So it's my pleasure to introduce both of these stellar nurses.
Thank you, Ms. Fox. Before we get started, Council Vice President Woods, would you please read the proclamation?
Absolutely, it's my pleasure. Council, whereas the World Health Organization designated 2020 as National Year of the Nurse in commemoration of Florence Nightingale's 200th birthday. And whereas Upper Chesapeake Health received the Pathway to Excellence designation from the American Nurse Counseling Center last year. This program recognizes a healthcare organization's commitment to creating a positive practice environment that empowers staff and where nurses have a direct impact on the safety and quality of patient care. Upper Chesapeake is also a part of the National Daisy Foundation, which recognizes nurses who demonstrate extraordinary clinical skills and compassionate care. And whereas the team of nurses within Upper Chesapeake Health have responded on the front lines of the COVID-19 global pandemic, which with remarkable professional commitment and dedication to our community. They have taken on the challenges of extended hours, adapting to additional roles and responsibilities, creating new and innovative workflows and care delivered models, and leveraging new technologies to communicate more efficiently with patients and families, all while providing quality care with heartfelt compassion and commitment to the profession of nursing. Now, therefore, the County Council of Harford County, Maryland, on this 5th day of May, 2020, do hereby proclaim May 6th through 12th, 2020, National Nurse Week.
Congratulations. I want to, first of all, thank you for taking time to be with us this evening. I want to thank you for all the efforts that you put forth on a daily basis, not to mention through the COVID pandemic, but every day. You guys are definitely the heart of our healthcare system here in Harford County. We appreciate your expertise, your compassion, your strength that you bring to all of your patients. And I think with that, I'm going to go to my council colleagues for comments. Councilman? Mr. Schroeds?
Yes, I just want to thank you all for what you do and, keeping everybody safe. And I know a lot of folks are home, but you're out there taking care of all those that need it, both dealing with the COVID-19 and others. And, Christine, I've known you for many years in your service to the Level Volunteer Fire Company and our fire and EMS, as well as your husband and actually your boys too now. So, thank you. Thanks for your family's service. But really thank each and every one of you, as well as the rest of your team. I don't know what we would do without you. So thanks very much.
Thank you, Mr. Schroeds. Anyone else? Christine, I can't let you go without acknowledging, I'm sorry, Tony. Councilman Jan Giordano?
Just want to unmute. I just want to take this opportunity to thank the staff at Upper Chesapeake, not only the nurses, the techs, and the people that take care of the rooms on excellent, great service that I had the opportunity to be a part of since I had to get emergency back surgery about a week and a half ago. Everybody in the hospital was great. They took care of me tremendously. Everybody was, anything I needed, they were able to help me with. They were able to comfort my pain, and I was able to go home, still in a lot of pain, but without having all those people there that did their jobs exquisitely. I couldn't have asked for anything better. So I want to thank you all very much again.
Thank you, Councilman Jan Giordano. Councilman Beulah?
Yes, I just wanted to thank you for all you do, and to all the nurses, and especially in this time of this pandemic, for the courage that you show. Without hesitation, you're taking care of everybody, keeping all of us safe and healthy, and just continuing to do a great job, an outstanding job. And just again, thank you for your courage, especially in these times. That's all, Mr. President.
Thank you, Mr. Beulah. Mr. Johnson.
Council President, I just want to echo all the sentiments that have been made tonight. And I just want to say, like, in the military, we call the NCO Corps the backbone of the Army. And the nurses are definitely, the medical professionals are definitely the backbone of the medical profession. So in this unprecedented time, I appreciate you, and we appreciate all that you do, especially in these times. So thank you from the bottom of my heart, and keep doing what you're doing, and keep it in keeping us safe. Thank you.
Thank you, Councilman Johnson. Anyone else? Christine, I was going to say, I can't let you go without mentioning that I've had the pleasure of watching you throughout your entire life. You continue to make us proud every day. We appreciate all you do. Thanks again.
Thank you.
I don't know if you guys would like to say anything or not, Ms. Fox.
Yes, Mary Kay, would you?
I would just like to say thank you. We greatly appreciate this award and this recognition. I've never been so proud to be a nurse and so honored to work alongside all these nurses that have come out and just dealt with all the challenges and changes, especially what we're dealing with today. And I'm so honored to be able to work here and to be able to accept this award on behalf of the Upper Chesapeake nurses. So thank you.
Thank you.
On behalf of the nurses at Harford Memorial Hospital, it is an honor for me to accept this proclamation. Thank you.
Thank you very much. We will share this with all of our nursing team tomorrow. Quite an honor. Thank you.
Thank you. Thank you all.
Thank you.
Mr. Sheldon, anything else before we go?
And I want to thank you for your service to our communities and your continued presence there on behalf of all of this county in the way that you serve so graciously and professionally. So thank you very much, and thank you for taking the time to recognize the nursing leadership and the nursing team that we have at both of our hospitals. So thank you. Have a good evening, and God bless you for your leadership.
Thank you, sir. Moving on, Harford County Employee Recognition Years of Service. We're honored tonight to have both Mr. Jeff Stratmeyer, Chief Engineer at DPW, and also Scott Kirby, the Deputy Director, Division of Construction Management for DPW, with us tonight. Both of them have decided to take a break from us for a while, and I want to recognize both of you for your service, or my colleagues, and I want to recognize both of you for your service. And we do have a couple of proclamations here. If you would, Councilman Schroeds is going to speak to Mr. Stratmeyer.
Good evening. Good evening to both of you. But first, I want to recognize Jeff Stratmeyer. Jeff, I've really gotten to know you since the beginning of my career at Harford County that extended prior to my time on the council. But I've really gotten to know you over 14 years in this position. And, you've been the rock that has been there the whole time. You know, some of our Department of Public Works directors have been with us and have moved on to other places. Some of the other supervisors, my dear friends, Linda, Ricky, and Kenny Gimmel, and now Kenny Sexton, who's still with us, they're now taking the helm of that. But you've been there the entire time, and you've always been there for me. If no matter what time of the morning or night, you've been there for me and all of my constituents of Northern Harford County, responding in detail to individuals reaching out to me on, via email or phone call or social media. You've always got back to them relatively quick. And of course, you living in Southern York County, you're passing through my district each and every day. And you always literally went the extra mile or 5 or 6, to check out various issues just on your way, either going home or coming into work in the morning. And I really appreciate that. But not only that, you have really done an awesome job to preserve our investment of our roads and bridges. You've not only to maintain them, but have helped me, and we've kind of bounced off of each other to preserve a lot of sections of rural roads while, taking care of those problematic areas. And I think that's satisfied a lot of those issues. But also our bridges, you've always worked with me to make certain bridges, within areas to blend in and be aesthetically pleasing in different sections of our communities. I can't wait to go out and visit Robinson Mill Road Bridge, which I know is just completed. And I know you all worked really, really hard on that one. And I know you have a great team too, but you've inspired them. You've inspired each and every one of those that work underneath of you, with those bridges. I also know you have a deep passion for roundabouts. I remember that years ago, probably over a decade ago, you came out. I'm the program chair of the Jarrettsville Lions Club, and you came out on an evening and talked to basically a bunch of older individuals about roundabouts and your passion for those. And, I really think you won them over. And of course, since then we have roundabouts everywhere and everybody's quite used to them. But back at that time, you were one of the only ones really talking a lot about a roundabout. So I appreciate that. I do think that they keep traffic moving safely and quickly, but while keeping the roads safe. I know that, of course, there are already various people that drive trucks that aren't a fan of them still, but for the most part on our county roads, I think that roundabouts work very, very well. You were with me. I was just thinking back. There was a large state road project going through Rock State Park, up through northern Harford County on Rocks Road. And, you were with us, with the constituents alongside and, helped a great deal with that. And I think that project has turned out great on that, Section A. There's going to be another section that comes soon, but I think it'll follow up right along. But, the road issues, the snow removal, you name it, you've always been there. I can't thank you enough. We're going to miss you. Whoever takes your place is going to have giant shoes to fill. And, I'll just always cherish our friendship. We knew each other pretty well before I started here, even on the basketball court. And you're probably one of the finest athletes I've ever met. But, I just wish you well. I know that you're going to enjoy your retirement and enjoy your family as well as your friends and that new grandchild that's on the way. I know your son's having in a little while here. So, I hope you have fun and I'll see you around the area, maybe for a beer. I know you're into that too. So thank you.
Thank you, Mr. Schroeds. Anyone else? Mr. Woods.
Thank you, Mr. President. Well, Scott, Jeff, both of you, we're going to miss you incredibly here in the county. I don't know how we're going to get through it. I remember my very first interaction with both of you, actually, back in when I first got on the council. It was Watervale Bridge and dealing with the constituents and how you guys handle that. I mean, it was being the brand new guy appointed in the office 12 years ago, and we're all sitting there, and I'm getting hit by hundreds of people about Watervale Road Bridge, and you guys were all over it for me, and able to really explain everything that go through there. Not just that was just the first thing. I was actually looking through some of my emails and some of my notes from back then and all the way through other issues, even up recently, Hess Road. How many times I've called one of you on a fire call where the road is broken or something's going on and the response back. But I just don't think, I'm hoping we get the same type of reaction or response from whoever replaces you guys. It's going to be rough. County exec's got a big job ahead of them trying to find someone that can to do this and also maintain and keep our roads going as well as you guys have. Maybe they'll pick someone that won't put as many roundabouts in, but I got to tell you, I do enjoy driving straight over them with a fire truck. It's a passion. I'm not going to lie. I mean, I tell everyone to hold on and I hit it because, why not? It's there. It's what you designed it for, right? So I haven't blown a tire out on one yet. So I think you guys did a good job doing it. But I want to thank you both for your service to the county and everything you've done to make our roads. And not just, there's something else too we don't think about. Some of the innovative stuff you guys came up with and trying new measures with some of the road or bridges that have been built, some of the new ways that the pylons and the bridge abutments were laid out and stabilized. Yeah, exactly. I mean, you guys brought stuff to us that no one ever thought about here before, and that's impressive. some of the road was covered, like Carsmill Road. Carsmill Road, except for the one spot where there's a spring in the middle of the road, looks phenomenal with that that cold system that you guys put on it. I know others failed across the county, but or a different process, but Carsmill Road one, it looks incredible. I had people that were very upset and worried about it, and had an email recently where a person said, "Man, I can't believe this thing is still holding up as well as it was." So you guys brought a lot of new stuff to the county, and we've learned a lot, and you're always there to answer questions for us. So I want to thank both of you and wish you best of luck on your retirement. Thank you.
Thanks. I forgot Scott.
Mr. Schroeder.
Scott, I didn't mean to leave you out. I was going one at a time, but thank you too for all of your service. I see you're at your kitchen now. I've seen you a lot downstairs in the kitchen on the first floor of this building. But anyway, I do wish you the very best in what you're doing in the future too. And thanks for your service here at Harford County. You've done an amazing job with the permitting and get a lot of our buildings going. And we have a lot of projects here in Harford County to be very, very proud of, and that happened under your leadership. So thank you, and best wishes in your future.
Sure. Thanks.
Councilman, anyone else? I thought it was important to have you both join us so that we could thank you for your service. We appreciate the fact that every time we called with a question, you were there to answer it. So we just wanted to send you off with our best wishes. So thank you all. Enjoy yourselves.
Thank you.
Thank you.
An honor.
Thank you. And Scott, Jeff, you guys want to say anything at all?
I would.
Please.
You don't mind?
Absolutely not. That's why you're here.
I've probably presented probably about 20 capital budgets to the county council over the years, and always had a great working relationship with all of you, and I really sincerely appreciate that. Want to thank the administration because they were always behind me and supporting everything that we were doing. But most of all, I want to thank the guys and gals that really do the work. Most our Bureau of Highways Engineering, like you said, Kenny Genow in the past, Kenny Sexton now, and the men and women there, they just do a fantastic job. Between snow removal on blizzards or major floods, they've just come through, and I've just been really impressed with them over the years. And then you say some of the innovations we've done. I mean, I might brainstorm some of these things, but it's my engineering staff that pulls them together. They're the ones that really have done the work. I come up with some harebrained idea and ask if they can do it, and they sort through it and they make it happen. So it's really them, the engineering staff. Just want to thank one other thing. I want to thank my parents for the morals they instilled in me. My wife, who's sitting next to me, is my supporter, and also my admin assistant, Karen, who has been with me when I came to the county 30 years ago and is still there now, and I'm going to miss her as well. It's been wonderful. So thank you all, and I will be seeing you around. I'm not going to be a stranger.
Thank you, Jeff. Scott, would you like to say anything?
Yeah, I would. I thank you all, council, for what you do for us, for the support of Public Works and for my team. I certainly enjoyed my time with Harford County. Got to see a lot of things. My folks are all over the county inspecting projects, so I've been able to get around a lot, and I've certainly enjoyed that. And like Jeff, I want to thank them because they're the ones who got the job done. You know, I'm back in the office pushing papers around, but somebody's got to be out there, be the face of Harford County to the contractors, and be the face of Harford County to the public. And those are the folks. You know, not many people are going to meet the county executive or the council president out on the job, but they see my inspectors out there every day, and they're the ones who keep it together for us. So appreciate all their work, and I will be around the county. Chad, you'll see me at Arbor Day whenever we have it again, and thank you.
Thank you both. Appreciate it. We're going to miss you. Moving on, council. Agenda item number 5, special presentations. Again, it's our pleasure to have with us Dr. Moy, our Harford County Health Officer, to give us an update on the COVID-19. Dr. Moy, welcome.
Hear me?
Yes, sir.
Yes, sir. Great. Thanks, Council President Vicente, and members of the County Council for inviting me to give today's coronavirus COVID-19 update. But first, in keeping with National Nurses Week, I just want to thank the nurses at the Harford County Health Department. They've really gone above and beyond during this pandemic, working around the clock. So I want to be sure to thank them. So first, an update on the numbers. As of this morning, worldwide, 3.6 million cases of COVID and 250,000 deaths. In the United States, 1.2 million cases and 70,000 deaths. In Maryland, more than 27,000 cases and 1,290 confirmed deaths. And in Harford County, 499 cases and 15 confirmed deaths. A closer look at the numbers, statewide, if you look at the age data, those folks under age 60, they make up 70% of the cases, but only 12% of the deaths, whereas those age 60 and older make up 30% of the cases, but 88% of the deaths. When you look at the zip code data in Harford County, Forest Hill 21050 has 131 cases. Bel Air North 21014 has 87 cases. Edgewood 21040, 65 cases. Bel Air South 21015, 42 cases. Abingdon 21009, 40 cases. Aberdeen 21001, 30 cases. And Joppa 21085, 30 cases. So these numbers, they could be skewed by the fact that two of Harford County's nursing home COVID outbreaks are in Forest Hill and Bel Air. So this is an indication of the importance of the location of nursing homes and other group homes when you look at the data by zip code. Finally, looking at the statewide recovery numbers that Governor Hogan has talked about, there has been a general plateauing of the numbers over the past 6 days. But if you look back at the last 14 days in Maryland, from April the 22nd to May the 5th, ICU bed usage has still increased by 9%. Acute care bed usage has increased by 24%, and total hospitalizations have increased by 18%. So we still have a little ways to go, but the last 6 days have looked much better. Next, I want to do a recap on some of the most basic things we've learned about COVID-19 in the past couple of months. And I wanted to go over this because there's been so much information coming in that it can get pretty confusing. So COVID-19 is still a very new disease, just a little over 4 months old. There's a lot not known about it. People are still learning as we go along. First, here are some things we do know. We do know it's an extraordinarily contagious disease. A recent CDC article states that a person with COVID-19 may be more likely to infect up to 5 or 6 people rather than the 2 or 3 people as originally thought. So scientists, they may measure how contagious a disease is by its basic reproduction number, that's referred to as R0, which is how many people a single infected person will infect in a population. Earlier, they thought that COVID-19 was thought to have an R0 of 2.2, but the new study now suggests the R0 is about 5.8. So that really supports just how contagious a disease this is. Second, we know that experts recommend that for social distancing, we should stand 6 feet apart in public. That's thought to be a safe distance if an infected person nearby is coughing or sneezing and spreading droplets that might carry the virus particles. But some scientists say that farther away than 6 feet would even be better, especially for those high-risk individuals like the folks 60 and over or those with underlying medical conditions, for a couple of reasons. First, sneezes, they can actually travel a lot further than 6 feet sometimes, according to some studies. Second is that smaller droplets can be aerosolized when people are breathing and talking, and they can spread by air currents a lot farther than 6 feet away. So the bottom line is 6 feet is a generally recommended distance for social distancing, but everything about COVID-19 is about probabilities. 3 feet is better than nothing. 6 feet is better than 3 feet. And if you're high risk, you should just probably stay home. Third, everyone agrees that there should be more testing, but many are still confused about the purposes of testing. So I just want to go over, there's 2 types of COVID tests. The first one is the diagnostic test done with the nasal swab, which tells you if you have viral particles in your system at the moment of the test. And the second is the serologic blood test, which tells you if you've ever been exposed to COVID-19 and have now developed some antibodies in your blood system to the COVID virus. In general, these tests are most useful for the scientists, epidemiologists, policymakers, health planners of the world, but not really for the general public. And for those scientists, it's to determine the population prevalence and it's to make public health decisions about isolating those folks with positive tests away from others until the infection clears. In general, these tests are not as useful for everyday people. And here's why. Let's say your diagnostic test comes back negative, and you think that's great, that you're in the clear. But you have to remember that a COVID diagnostic test has an inherent false negative rate of 30%, which means that it could be wrong 30% of the time. Let's say your diagnostic test comes back positive, and you think, oh no, you're contagious. But that test only tells you that you have any viral particles in your system. It does not tell you if your viral load is large enough to make you infectious or not. Let's say you do a serologic blood test to see if you've ever been infected with COVID-19 and the test is positive. You think that's great because now I know I'm immune to reinfection. But right now, no one knows how much immunity or how long any immunity may last, even if you've been exposed. So the bottom line, the usefulness of these tests for any given person is limited and sometimes may even be misleading. Everyday people should not be making personal decisions based on assumptions about these tests at this time. Just assume that everyone is infectious at this time and keep a safe distance from everybody. So these 3 points bring us back to the original point. COVID-19 is still a very new disease with a lot of unanswered questions, and everybody is still learning as we go along. Next, an update on what's happening at the state. So on Wednesday, April the 29th, governor's executive order was issued, and the governor's order directed the health secretary to increase testing of residents and staff for COVID-19 and nursing homes and other similar healthcare facilities. So in Maryland, COVID-19 has spread through nearly 200 facilities, infecting over 4,800 staff and residents in those nursing homes, accounting for over 500 deaths. The data shows that 18% of Maryland's COVID-19 cases and 44% of Maryland's confirmed COVID-19 related deaths are linked to nursing homes. Maryland's 44% nursing home related deaths is higher than California's 30% rate and higher than New York's 20% rate and higher than the country's average of 27% of COVID deaths in nursing homes. So it's very high in Maryland. Employees who test positive, according to this executive order, will immediately self-isolate, and this may cause some nursing home staff shortages. So the state is deploying what they call bridge teams of state contracted nurses and health aides. So these bridge teams will be led by the Maryland National Guard, the State Surgeon Colonel Eric Alley. Also, on April 29th, the MDH Health Secretary issued an order that provided more details to the governor's executive order. And this was specifically directed at nursing homes, and it contained 5 components. The first one is it required nursing homes to update its emergency preparedness plan. Secondly, it required all nursing homes to immediately report its outbreaks to CRISP, which is the Statewide Information Exchange. Third, it required nursing homes to provide informational updates on COVID-19 to residents representatives, and staff within 12 hours of the occurrence of a single confirmed infection of COVID-19. And that informational update had to be followed by weekly updates. Fourth, it requires that, as directed by the Maryland Department of Health, a nursing home shall perform universal COVID-19 testing on all residents and staff. But I can tell you the details of all this is being worked out as we speak. It's my understanding that the MDH epidemiologists and infectious disease specialists will be working with Colonel Alley and the Nursing Home Task Force, and they're going to prioritize the order in which nursing homes will be assessed, and they're going to talk about the exact logistics of the testing that follows. Once universal testing of a nursing home is done, and then they really have to be ready to act on that. They have to isolate all the positive staff. They have to bring on replacement staff if necessary. They have to separate or cohort positive residents away from the others. So one caveat about universal testing is that testing can only gives you information about that point in time, since the tests are not always accurate, especially with that high false negative rate of 30%. And the fifth component of the health secretary's order is that clinical staff basically round on all the residents every day, and that they report any abnormal findings to the medical director. So you can see there's a lot of attention now placed on the nursing homes, because that's one of the biggest areas of concern in Maryland. So these actions, they reflect the understanding that nursing homes and similar facilities, they have some of the highest risk folks because they're over age 60 and they have underlying medical conditions. But it also points out just how vulnerable nursing home settings are. As one study showed, that more than 70% of nursing home residents who had not yet had any symptoms were still shedding the virus. So basically, you can seem perfectly well, but still be shedding the virus, and you can be infectious. So that without any warning of symptoms, infections can spread very rapidly in nursing homes, leading to their having the highest fatality rate of any group of individuals in the state. Next, I want to go over an update on county developments. But before I give my update on county developments, and especially as folks are beginning to talk about relaxing social distancing rules and getting back to normal, I just want to review a very basic framework for understanding the many, many complexities of the COVID-19 situation. We know there are high-risk groups, again, those age 60 and older, and those with underlying medical conditions like diabetes, heart disease, and lung disease. We also know there are lower risk groups, not that they can't contract and get the virus and get very, very sick from the virus, but their immune systems are usually strong enough that they don't usually die from the virus, at least not in large numbers. These lower risk folks are the younger, healthier people. Again, more than 80% of people have either mild or no symptoms from the COVID infection. But there's a third group, and this is the most challenging situation that we have. This is the group of people who may be young and healthy and part of the low-risk group, but they may be asymptomatic carriers of the virus. And this third group are the ones that may interact with, they'll interface with the high-risk group. These folks are household family members, caregivers, healthcare workers, first responders, and now, more broadly, people are talking about any essential worker in a critical infrastructure business, That could be grocery stores, fast food stores, construction workers. So the broader you make this third group, this is the group that interfaces between the healthy group and the not so healthy group. That's the toughest group to define and the toughest group to give guidance to. Some of that guidance now is they should wear masks, wear PPE, stay 6 feet away if at all possible. But you see how easy it is to bend or break one of those rules. And when you have a virus that is lightning fast contagious, and all it takes is one transmission to cause a deadly outbreak, you see how challenging this entire situation is. So when people call me up to ask, is it safe for so-and-so to do such and such a thing in a particular location on a given day, there is no particularly good answer except to say, you know who the high-risk groups are, you know how easy it is to transmit the virus, and you know just how careful you can and cannot be in a given situation. So you have to use your judgment to make the call. It's a probability call. And those collective calls that we all individually make within a community, it's those calls that will determine where Harford County numbers will go moving forward from today. Having said that, Harford County, like the rest of the state, we're grappling also with numbers of cases in nursing homes. You know, there's good communication between the nursing homes, the hospital, the emergency managers, the county officials, the health department. We've really communicated a lot over the past several weeks and months. Given the extraordinary contagiousness of COVID-19 and the fact that asymptomatic persons can transmit the virus to others, you can see that despite careful infection control procedures and compliance with guidelines and rules and regulations, all it takes is one person, completely symptom-free and seemingly healthy, bringing that virus into a nursing home, infecting one resident, and then a mammoth outbreak could ensue within a matter of a few days. At this moment, after 2 months since the arrival of COVID-19 in early March, Harford County, we've been fortunate to have numbers not quite as large as those in similar sized jurisdictions. For example, of the 11 Maryland jurisdictions with at least 500 or so COVID cases as of this morning, if you adjust for population and come up with not just the number of COVID cases, but the number of COVID cases per capita, here are the numbers. Prince George's has 864 COVID cases per 100,000 population. Montgomery County has 533. Wycomico, 489. Frederick, 431. Charles, 419. Baltimore City, 424. Baltimore County, 414. Anne Arundel, 360. Howard County, 320. Carroll County, 306. And Harford County, 199 COVID cases per 100,000. That's adjusting for population. If you look at the confirmed COVID death rates for those same 11 Maryland jurisdictions, here are the numbers. Prince George's County, 31 confirmed COVID case, 31 confirmed COVID deaths per 100,000 population. Carroll County, 31. Charles, 30. Montgomery, 28. Frederick, 24. Baltimore City, 20. Baltimore County, 17. Anne Arundel County, 17. Wycomico, 11. Howard, 7. Harford, 6 COVID deaths per 100,000 population. If you compare that with the United States and other states in the country, the U.S. as a whole has a COVID death rate per capita of 20 per 100,000. Maryland as a state, 21 per 100,000. New York, 124 per 100,000. Pennsylvania, 21. Delaware, 17. Virginia, 8. So Harford County's 6 deaths per 100,000 population. That, I think, is a testament to the strong collaborations among Harford County agencies and partners, as well as a testament to the Harford County community at large that is in large part taking social distancing seriously. But here's a caveat. All it takes is that one inadvertent viral transmission from one seemingly healthy, asymptomatic person to one high-risk person in a nursing home or a group home or a detention center or any other congregate living setting. And all of our numbers over the past two months could dramatically change in just a matter of days. So this should be important to all of us as a community. And as a community, we should be aware, we should be careful, and try to be as safe as possible. So with that, I'm happy to take any questions.
Dr. Moy, thank you again for your presentation. Council, at this time, it's your time for questions. Anyone? Councilman Woods.
Thank you, Mr. President. Thank you, Dr. Moy. Do you have any data or any thing I can explain or talk about or compare where China is today compared to where we are in the United States?
Yeah, that is a very unfortunate situation because I believe most folks don't believe we have all the data yet from China. So that's probably at a much higher level than where I am. But unfortunately, I think that's where it started, and we still don't know what that data looks like today.
Right. And do you have any data or anything coming back in that's indicating that this could have been here earlier than what we expected, or you see antibodies coming back?
So, there's studies that have shown that most likely it was here in January and even possibly in December. So, and those are anecdotal studies, but I think a lot of people are beginning to feel this is much more prevalent than we originally thought.
I definitely agree with that. Because I look at us, at the fire departments and everything from there, and I know in the beginning, around end of December, early January, it went through most of our fire departments, or everybody was sick. I don't know if this went through because we haven't had antibody tests yet, and I was sick for 3 weeks, 102 temperature for about 2 weeks, and the worst trouble breathing I ever had. I almost gave up and went to the hospital for the first time. And it was, if it wasn't for being able to give myself a nebulizer and various meds, I don't know if I would have made it without going to the hospital. But my wife got sick very quickly and was sick for a week or two as well. So I think at least I know the antibody test isn't the most, it shouldn't be used as getting people back to work or any of that. But I think it would be interesting, especially for our first responders here in the county, to know what we're dealing with. Because right now at the firehouse, everybody's healthy. We're exposed to people every day. And it goes back to the firehouse. We, of course, have done multiple steps to make sure everything is clean and everything is as safe as possible. But still, you get off the ambulance, you clean up as much as you can, then you go into the crew room. And the next person comes into the crew room. And social distancing happens as much as you can. But let's face it, you have 6 or more guys in the back of a fire truck or in an ambulance, you're closer than 6 foot. And so far, it's just not, we're lucky it's not going through us unless it already has been there and we've recovered. But I think if anything, if the county could help or get a program or something for first responders with antibody tests, and I'm getting calls for that from other first responders too, fire service people. So if we can do something like that in the future, I think it would help us a lot, especially if you're preparing for a second wave of this. Also, do you have any insight or any thoughts on basically straight up people's calls for putting everyone back to work or opening stuff back up? What's your thoughts on that?
So I can tell you my public health thoughts and my personal thoughts. So my public health thoughts probably coincide with the governor's, what he's saying about You need to see hospitalization rates go down. You need to see ICU bed usage go down. You need to see acute bed usage go down. I totally agree with that. My personal thought, though, is to have people social distancing for months, and I'm talking about many months, that's probably very, very difficult to sustain. That's why what I was just talking about a few minutes ago had to do with more targeting. It's like, you know who the high risk groups are, and those folks really should just shelter in place for as long as they can. You know who the lower risk groups are. It's that middle group. It's the folks that interface between the healthy and the not so healthy. That group have to figure out, how can we reduce the probability that they're bringing they're a carrier of a virus that could then infect a nursing home. And once you infect a nursing home, you're going to get a lot of cases. So I don't know exactly how that's done, but to me, that's where the focus should be on, not so much closing all society down, but really trying to segment and target the folks who really get sick from this and the ones who may just be carriers. I don't have the answers, but I know it's going to be hard to have social distancing for many, many months.
I definitely agree with that. And I agree with social distancing. And I agree with the mask and properly fitted mask wear. I think we need to do a little better with maybe educating people how to properly wear a mask and how to properly dispose of them. In fact, I've talked to members of the Folsom Firehouse, and we might put together something with the help of the council and maybe put a PSA out of how to properly dispose of it and do things of that nature. Because, you see a lot of people wearing them incorrectly and the biggest thing I notice is not just that they're wearing them, but they're constantly adjusting it or touching it. And if the mask is obviously doing its job and you're touching where you're breathing in, you're potentially cross-contaminating yourself. So people need to really think about that. And I've seen people take it off and put it back on the other direction too, which really doesn't help you one bit. And, I see that part of my wife's store, she's still open. We're very fortunate that we're still open, but we cut our hours. We took a lot of steps at our shop to make everything as safe as possible. With the first thing in the morning, she gets there, we clean everything. It takes about 45 minutes. We do that 3 times throughout the day. We know we can have up to 10 people in the store, but we limit it to 5 anyway, including locking the door, put a buzzer on the door. At 5, we don't let anyone else in. We have a unique situation. We have turned up our air vents and pressurized the building, also changed the air vents and things of that nature. Of course, all the markings and stuff of that nature to keep people safe. But we have a unique issue at our store, which governor's office helped us out with, but we sell sensitive equipment, including firearms and police gear. Well, federal law and part of state law says you can't transfer a firearm with someone with a face covering on. So we worked out, we use our best judgment as what the state recommended. But, most of the time it's public safety people that are in there. And with limiting it to 5, I feel we've taken a lot of steps to make stuff safer. I look at a piece of her security system malfunction the other day. I had to go to Home Depot to get a piece, and there's boatloads of people in there. I mean, unbelievable amount of people. And I quickly thought, I'm like, my store is much smaller than a Home Depot. I definitely feel much safer in a small business than I do in a big box store. And it bothered me as a healthcare provider and as a small business owner, seeing things like the garden center, people buying things that are truly not necessary as far as I'm concerned, plants and stuff of that nature. And then I see places like outdoor venues that are closed that make absolutely no sense to me. Why would a drive-in movie theater need to be closed? Why would a car wash need to be closed? And golf course, perfect example. There's things like that outside eating at a restaurant, if we can keep people safe going into Walmart, Home Depot, and any of these, why can't someone go into a small mom and pop shop? And of course, we've all sent our concerns down to the governor, but it's as a small business owner and a healthcare provider, and it's a hard piece for me to say, oh, we need to open tomorrow, because I'm realistic. I know we can't. But what this is doing is just traumatic for the economy, the community, and business owners themselves. I'm not seeing the call volume. We're not running as many calls. Call volume's down. The ER visits are down. I'm not saying we should open up, but I think we should be more intelligent about going on. And I know this isn't your thing to fix directly, but I'm hoping that you can take at least my words or some of ours back to your channels and say, we really need to look at getting private businesses, small businesses open again, even if it is limited less than 10. We got to do something. And I call on all of our council members to take this next week or so to really evaluate your district and your businesses in your district, because I think it's going to come to a time soon that we're going to have to make a statement. We'll have to come out and say it's time. And the governor might not like it, but I think it's something that's going to have to happen. And I hope if we get to that point, Dr. Moy, that you would make sure that we are on the right plan and we're able to move forward and make it safe for everybody to get back to work safely. So I know it's more of a statement than a question, but personally, I just feel much safer in the local mom and pop shop than I ever do in a Home Depot, Lowe's, or any of the big box stores. But thank you and all your staff for what they do. It's reassuring knowing how dedicated you guys are and how much you've done to help us. So, but thank you for everything.
Thank you, Councilman Woods, Mr. Mr. Schroeds.
Thank you, Council President. Dr. Moy, I was very interested in what you were saying on your personal thoughts in response to Councilman Woods' question. It does seem like there may be a creative way. I guess my question to you is, do you have an opportunity to kind of chase those personal thoughts that you had? I thought they were well thought out. I think that they make sense to me. Have you had an opportunity to get those up the flagpole to your superiors as one of the 26 health officers around the state? I do feel like, constituents of mine, we're all getting anxious. I just feel like we're getting very close to a point where people are going to be rebelling a little bit. I've noticed that out on the roads coming in today to the office, you see a lot more traffic on the road now than you had before. So I think that while everything is still in effect and nothing's changed, we do see more people out and about. And I think you're going to see more of that. I think people are going to become more outspoken about this issue. And I think that there could be more balance. I like what you said about, those folks that are, more apt to getting this, staying away from them, having them more quarantined than the rest of us moving public. But it is like, how do you figure that out? How do you keep that middle-aged demographic who is in contact with younger people as well as older people? But I think maybe if, we could brainstorm a little bit, explore what other areas are doing around the country, around the world, what might be working, maybe think about that a little bit more. I do feel that some small businesses, like Councilman Woods said, certain recreational types of activities like golf, I think that is a sport or a type of activity that, we could start operating again. As for the clubhouses, that's a different story, but I think we need to, kind of think more ahead, because pretty soon people are just going to just do what they want anyway. I don't really know how else to say it, but businesses are hurting really bad. There are so many people out of work. We're looking at 30% unemployment. This is going to be horrendous for our economy, not just right now, but into the rest of the year. I don't know how long it's going to take to recover, but, there's a certain amount of health that, you have other mental illnesses, I believe, that will come into play when people are out of work and they're not making money and they can't pay their bills. You're going to have depression issues. You're going to have more alcoholism, more drug use, more suicides, more mental illness. We're going to, I just hope that smart minds can come together and, think of what is the best direction to go, coming up with a plan for how we're going to move ahead, how we're going to move out of this and get back to normal. I realize that normal is going to be different in the future, but, I really liked what you said is I'm going off on a tangent, but really what I'm saying, what you said made a heck of a lot of sense to me. And I'd like to see that get out more. I know that was your personal hat, not your public health hat there, but to me, it kind of made a lot of sense. So, I want to see what you can do there, please.
Well, no, I totally agree. We need to find a balance, and I certainly don't want people to rebel because that would probably be the worst thing.
Thank you, Mr. Schroeds. Mr. Beulah.
Yes, thank you, Council President. I just would like to echo the sentiments of Councilman Woods and Councilman Schroeds because I've been getting a number of emails. I've been talking with a lot of business owners. And, I understand we need to be cautious about this because we're in uncharted waters and this virus is highly contagious. But I think we need to apply common sense. As Councilman Wood said, I stopped in the Home Depot to just pick up a couple little things. I needed to repair my toilets. I noticed you got the people there and, but yet we can't go on a golf course. This is a time where, to me, it's not applying common sense here. I think we can, like Councilman Schroed says, okay, we got one thing with the clubhouse, but as far as getting out on the golf course, we can have better social distancing than we have in the big box stores. So, again, appreciate your comments, but let's see what we can do to apply some common sense here with caution. So that's all I got to say, Mr. President. Thank you.
Thank you, Mr. Beulah. Anyone else? So, Dr. Moy, first of all, I hope everything is well with you and your family. It's good to talk to you again today. I want to let you know that in your absence, Miss Alston has done an outstanding job keeping us up to date with all of the statistics throughout each and every day. She has been there to answer phone calls. Sometimes 2 or 3 times a day I call her, but she does an outstanding job, and I just want you to know that. I also want to commend them on their role in working with our businesses to handle any type of complaints that are coming through. They do keep me up to date with a spreadsheet of what businesses they're looking at and what complaints are coming in. And I do believe they're doing an outstanding job working with those businesses to bring them into compliance. And I just wanted you to know that for sure. I'm sure you already know it, but I wanted to commend them on the job that they're doing. So with that, I want to thank you for participating this evening. Look forward to talking to you again soon.
Okay. Thank you very much. Appreciate it.
Thank you, sir. Agenda item number 6, approval of minutes, legislative day 20-013, April 21st, 2020. Special legislative day 20-014, April 28th, 2020. Are there any corrections to the minutes?
None.
There being no corrections, the minutes stand approved. Vice President Woods, would you please read in bills 20-010 and 20-011?
Thank you, Mr. President. Bill 20-010, Pay Plan and Classification Plan, introduced by Council President Vincini at the request of the County Executive. An emergency act to repeal the Harford County Pay Plan and Classification Plan, Harford County Ordinance Number 19-010, and to enact a new Harford County Pay Plan and Classification Plan to stand in lieu of the ordinance repealed, to provide a pay plan for county employees, all in accordance with Section 603 of the Charter, and to provide that this act shall not be codified in the Harford County Code. Introduced, read first time, order posted, and public hearing is scheduled for Tuesday, June 2nd, 2020 at 7:15 p.m. Bill 20-011, Zoning Parking, introduced by Council President Vincini at the request of the County Executive. An act to add the definition of local delivery to Section 267-4, definitions of Article I, general provisions, to repeal and reenact with amendments subsection E, shared parking provisions of Section 267-26, off-street parking and loading, of Article V, supplementary regulations, and to repeal and reenact with amendments the permitted uses chart, warehousing, wholesaling, and processing, all of Part 1, standards of Chapter 267, zoning, of the Harford County Code, as amended to establish a definition of local delivery, to allow shared parking on other properties up to 2,000 feet from the site being developed in the CI, LI, and GI zoning districts, and generally related to zoning. Introduced, read first time, order posted, and a public hearing is scheduled for Tuesday, June 2nd, 2020 at 7:15 p.m. Once again, all these bills are pending the ongoing health emergency and the governor's orders. The meeting may be held virtually or in the council chambers. Please check the website for updates and additional information.
Thank you, Mr. Woods. Agenda item number 8, introduction and consideration of amendments. Councilman Wagner. Amendment 1 to Bill 20-005.
Right. Amendment number 1 was introduced a week or so ago, or 2 weeks ago, and it was for Bill number 20-005. Upon closer scrutiny and checking out the legalities of it, it appears that this amendment encroaches on the administration's powers and potentially violates the charter. And for those reasons, I will be withdrawing amendment number 1 to bill number 20-005.
Thank you, Mr. Wagner. Appreciate that. Agenda number 9, business from the president. Our budget public hearings are scheduled for Wednesday, May 6th at 7 p.m., Thursday, May 14th at 7 p.m. Both meetings will be held virtually and streamed on Harford Cable Network YouTube page and archived on our website. If you'd like to testify, you must be registered to speak. And for more information on how to register, please visit our website or call our office at 410-638-3343. As you heard earlier, my colleagues and I continue to work with all of our citizens and our small businesses looking for answers to many of the questions and concerns that we hear every day. The majority of the questions that we're receiving as you heard earlier too, are can you guys hear me? Okay.
Yes, can hear you now. You went dead for a minute there.
Okay. So, as I said, my colleagues and I continue to work with our citizens and small businesses looking for answers to many of their questions and concerns as we go through each and every day in these uncertain times. The majority of the questions we are receiving are about unemployment benefits, reopening strategies, and the PPP loans or grants. Several of us, as you heard earlier, are small business owners, and we truly understand and have experienced some of the same concerns and challenges that our business community is faced with. We are in constant contact with the governor's office, our county executive's office, all of our elected officials across the county to find ways that we can get our businesses open and fully operational in a safe and healthy environment. This past Friday, I had the opportunity to sign on to a letter from the Maryland Association of Counties addressed to Governor Hogan with 19 other counties seeking their support to release federal CARES Act funding to our local jurisdictions, which will help them to support our small businesses. With that, I'd like to call on Councilman Johnson.
Thank you, Council President. I have nothing tonight. I'll yield my time back.
Thank you, Councilman Johnson. Mr. Woods.
Thank you, Mr. President. Last week, actually in the last couple of weeks, I should have brought this up, but I didn't. I want to actually thank the Director of Labor and Licensing, Tiffany Robinson, for addressing the public safety and essential worker haircut issue. We brought it up to the council member, and I believe we had an answer within the next day, and it was actually put out through an order shortly after that. So as you heard, she said during her statement that this is the first she heard of that issue, and they were able to take care of it very quickly. So I really do want to thank Secretary Robinson for fixing that issue. I also want to thank the liquor board. I had a handful of the restaurants and bar type establishments in the district that called, and they're worried about the licensing renewal that's due, and they're kind of unclear what they're to do, what's going to happen with that. The liquor board is going to take that issue, and I believe they're going to make a decision Wednesday night to help that. And I want to thank them for looking into this issue and getting back to our restaurant owners as quickly as possible. Also, Council, I said it earlier with the Dr. Moy, but I can't stress more that I believe each of us really do need to look at our, I know you all are, but I think we all really need to look into our districts and see how individual businesses can maybe open differently. And let's face it, some businesses will open and there probably still won't be a lot of people going to it just because of fear factor, or some businesses, if they were open this whole time, might not see many customers. Ours, that's happening to us. We're fairly busy. We reduced our hours, and doing that, it kind of compresses all of our customers into the 4 days that we're open. But we've still seen a huge loss over the last month and a half, 2 months. So our numbers are much further down than they were in years past at the same time. So it's affecting everybody, even the stores and businesses that are open. Restaurants, same thing. There's the carry out. People are getting so used to the carry out option that restaurants that normally just do carry out business are actually suffering more. I've lost at least one, maybe two restaurants in the district that just closed this week, and they'll announce that they're closed. They're not going to reopen when this is over. And their primary business was delivery. So it's a shame. I mean, we're starting to see it now. And I think, as many of you said, we can be smarter with this and safer. Like I said, I know my store. I know the distance of it. We limited it to 5. We didn't need to, but we felt that was the best way to keep everyone safe in the building. And I think property owners and business owners are smart enough and care enough about their customers that they're going to take the extra step to make sure people are safe, and especially their employees. And finally, I want to, tomorrow is my mother's birthday, so I want to wish her a happy birthday. She watches every single council meeting. I have no idea why. She lives next to me, so she can come see me anytime she wants, but she loves watching it on TV. So I'm going to wish her a happy birthday today because she'll watch it tomorrow. So, Mom, happy birthday. Thank you.
Happy birthday, Mom. Councilman Jan Giordano.
Thank you, Council President. I'll waive my time this evening.
Glad you could join us this evening and look forward to talking to you tomorrow.
Thank you, Council President.
Thank you, Council President. I just hope that all of my older friends in my district and all around are okay. One of those people that do like to visit them, and quite frequently. As you know, I do a lot of Harford Living Treasures, so I'm very close to many of them, and I miss them, and I hope this is all over soon, so I can get out and do more visiting with you. Also, hats off to my legislative aide who happens to be with us this evening. I haven't seen her since this all began, probably about, 2 months ago. She has been working very hard remotely from home, and she has been keeping the fort down along with me, but she is in the office today. Not only, well, never mind. It was very important that she made a visit today, I think. So I had a lot of letters to sign and all that, but thanks for keeping me straight. And of course, our office is always open, whether we're here or we are remote. So I do have something to share this weekend, and it reminded me, you might have saw me, I ran out to get my phone, because Scott Kirby mentioned Arbor Day. That is an event that I have never missed since Harford County has had Arbor Day, and this is the first year I have missed, along with many other people. It was supposed to be at the Waste Disposal Center on Good Friday, but of course that was canceled, like all of our large gathering type of events. But with that said, the Harford County Forestry Board has many, many trees to give out. So not only have they not had Arbor Day, but many other community events and Earth Day celebrations, etc. So this Saturday, May 9th, from 8 to 1, they are giving away trees, 10 per carload. So you don't get out of your car, you pull up, you get your 10 trees. I'm sure you fill out a little paperwork, and then you go off on your way. So I hope that many Harford Countyans come out and enjoy this opportunity. They can take these trees home. They can plant them with their family or those in their little group that they're quarantining with, and have fun with it. So, please take advantage of that and do that. Anyway, that's all I have tonight. Take care. See you next week.
Thank you, Mr. Schroeds. Mr. Wagner. You done mute your mic, sir.
That works better.
Yes, it does.
Can we suspend the rules to go back to agenda item 8 to pass or take up for consideration bill number 20-005? That could be moved on this evening, correct?
It can, but I have it on next week's agenda already.
Oh, you do?
Yes, sir.
Okay. All right. Well, thank you for that clarification.
Yep.
And certainly we appreciate all the updates we got from Dr. Moy and certainly from Lyle Sheldon. We had a conversation before everybody got started talking about the Upper Chesapeake and what they're doing right now and the way that things are going with the hospitals here in Harford County. And certainly wish all well. And it's good to hear Tony G back on the dais remotely, but it's good to hear his voice back around. So wish him well, and we will all be in touch. Thank you.
Thank you, Mr. Wagner. Mr. Beulah.
Nothing tonight, Council President. Thank you.
Thank you, Mr. Beulah. Mr. Schroeds.
Thank you, Council President. I just realized there was one thing that I think a couple of us may have forgotten. We lost our security guard here who's been with us for many years, and our guard. So please keep.
Excuse me, Council President, we can't hear
you. You need to turn your mic on.
Sorry about that. Didn't have the mic on. We forgot one thing. One of our beloved security guards passed away recently to COVID-19, and he served our country, served the police, and that's why our flags are half staff in Harford County, because of Andy. So please keep him. Please keep his family and friends in your thoughts and prayers. I know we'll surely miss him. So that's all I have tonight. Thank you.
Thank you, Mr. Schroeds. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President. I believe I had given that information to Ms. Harris and you regarding Mr. Malamo, who would like to have a call back this evening.
Thank you. She's calling him now.
Malamo.
Good evening, sir. It's Council President Vincenti. How are you?
Oh, I'm well, sir. Good evening. Thank you for asking.
For the record, sir, could you please give me your name and address? And you had 3 minutes.
Thank you, sir. John P. Malamo, 2402 Eagle View Drive, Bel Air, Maryland, 21015. Continuing on, addressing the Glassman administration approach to the zoning status of Harford County Airport at 3538 Aldina Road. When asked about the construction at the Harford County Airport, the Glassman administration states that the airport has a special exception. When asked about the zoning status and compliance with the zoning code and conditions of the special exception, the Glassman administration claims the airport operation precedes the code and is operating as an existing legal non-conforming use, implying that neither the code nor the conditions of the special exception apply. We're referring to the Pyrrhic Court for treatment of this situation and quoting, a property cannot operate where the use is both a non-conforming use and a special exception use when it is the same use because the permitted use extinguishes the non-conforming character of the use. The law requires that the conforming permitted use be favored, i.e. the special exception. I would submit that the Glassman administration either did not understand the law or simply ignored the law and has effectively overruled the hearing examiner's recommended decision, the Board of Appeals' final decision, the ruling and order of the Circuit Court for Harford County, and the Maryland Court of Appeals. Gentlemen, this is a failure of government. It's also a failure of the Zoning Board of Appeals to allow the situation to develop and continue. This is your failure. The conditions of the special exception in the zoning code make the use compatible with other uses in the appropriate district. Where the conditions in the code are not observed, then by definition, the use is not compatible with other uses in the district. Neither the county executive nor the director of planning and zoning have any authority for granting or modifying special exceptions in Harford County. That authority resides solely with the Board of Appeals. With that authority comes responsibility to ensure the conditions of the special exception and the zoning code are observed. A penalty is prescribed for failure to comply. $500 a day with each day of noncompliance a separate offense. Beginning our review of the contents of the site plan approval letter, we start with these questions. Can any of you tell me why the Glassman administration continues to recognize the Harford County Airport as an existing legal non-conforming use? Do any of you really expect me to believe that the Zoning Board of Appeals or the county administration will uphold the zoning hearing examiner's recommended decision as ratified and adopted by the Zoning Board of Appeals and affirmed by the Circuit Court for Harford County or the county code? I'll leave you tonight with this question. If the population cannot trust the government and governing bodies to know and follow the law, how could that population have trust and confidence in any other actions of those bodies? Good night.
Good night, sir. Anyone else, Ms. Dixon?
There is no one else signed up, Mr. President.
With no one else signed up, this meeting will be adjourned. Thank you.